As Paul said, my name is Jan-Philipp Beck. I'm the CEO of EIT Health. It's great also to see so many of you here. I understand that it's only this keynote, the commentaries, and then the subsequent roundtables that are between you and the fantastic gala dinner tonight. So thank you very much for hanging in here. I have a few key points for today. So I would like to firstly say a few words about EIT Health, because I understand that the organization and what we do, what we strive to do, might not be known to everyone. So I want to share with you what is EIT Health, also what is the EIT, which is the European Institute for Innovation and Technology, which is the body of the European Union under which umbrella we have been established. And then I want to share some key messages on innovation needs and approaches that will later be discussed at the roundtables, and I'll try to segue to those roundtables with a few questions that we can then also discuss here. So EIT Health, as Paul already said, is essentially a network. It's a network of people that I would call health innovators, and we collaborate across borders to deliver new solutions that can enable European citizens to live not only longer, but also healthier lives. And the people behind EIT Health are passionate about innovating in health and healthcare in Europe and worldwide. And these health innovators consist of experts, thought leaders, scientists, clinicians in 140 member organizations all over Europe, many of them actually also represented at this conference. So our innovators come from some of the finest companies we find, including medtech, digital health, pharmaceuticals, but our network also includes researchers, innovators in universities, research organizations, and very importantly, of course, also doctors, managers, clinicians who are working in hospitals, primary care, care homes all over Europe. We are then clustered around 6 what we call co-location centers in Europe, and we have an InnoStars outreach network. And these locations, you see them dotted there on the slide, are where most of our partners also cluster in Europe, and where we have small local facilitation teams that engage our partners in the various activities. So Paul also asked me that when we got introduced to each other a few minutes ago, and he said, well, so why is there a need for an organization like EIT Health, and what does it actually do? So if you think about it, I think a lot of what we take for granted today, we owe to such innovative minds as yourselves today in this audience. Our lifespans are prolonged due to vaccines, antibiotics, surgery methods, and I could go on with this list. But however, now all of us together are facing a big challenge that is also central to this conference. So after everything innovators have achieved over the past century or so, we now strive not only for longer, but actually healthier lives. And that's a totally different challenge. And that's mainly for 2 reasons. The first reason is simple. Living longer lives is, of course, worthwhile. Better than suffering for a long period of our time or being dependent on healthcare. I think 1/3 of the world's population is already dealing with 5 or more chronic conditions today. The second reason is, and that's also, I think, a major topic of this conference, is that most of the costs in the healthcare system are generated over the last years of our lives. And that means that we need to solve this challenge if we want to make our healthcare systems sustainable and resilient for the future. Now, we know that we need to support Europeans to live healthier and active lives so that they can experience more healthy aging. And we believe that we need innovation and collaboration for that, technological and medical innovation as well as digitalization, because here lies the opportunity to move beyond conventional approaches to treatment, prevention, and healthy lives. And I'm saying it is not only innovation that makes a difference, but I think it is a key component and it can unlock a lot of energy. So in EIT Health, I believe we are uniquely positioned to make innovation happen at that intersection of research, education, and business. So we start always with a clear understanding for the problem, and we identify unmet needs of citizens and patients and the clinical and economic needs within healthcare systems. And based on these needs, we initiate innovation in our network. And in that network, I think we have incredible knowledge about how we age, about diseases, how we can treat them. We also have knowledge about human behavior, so how we function, and of course about technologies. So what makes EIT Health so valuable is that we ensure that innovation always addresses the needs of the market and of course society at large. So this is where our main slogan comes from, Together for Healthy Lives in Europe. We believe that our innovations ultimately contribute to our goal to enable people to live longer and healthier lives, and we understand that tackling this challenge means that we have to work together and that we need to collaborate in Europe. So what does that mean in practice? And how do we practically work in EIT Health? Well, it is actually quite simple. We do projects. We do projects all over Europe that are run by multidisciplinary international teams trying to create examples that show how we can solve the challenges that I have talked about. In a sense, they prototype the future, and if they are successful, we try to scale them up. So next year, there will be almost 100 projects that will leverage contributions worth about 300 million euros coming from our partners, private and public sources. So what exactly does EIT Health then contribute apart from identifying needs and initiating innovation, as I described earlier? So we like to say that we indeed, as you see on this slide, we facilitate, we collaborate, we create, and we educate. So we facilitate innovation in programs, workshops, and initiatives. We collaborate on international projects, incubating ideas. We also form startups, support entrepreneurs, and we disseminate our findings in events and publications and media. We create new products for services and services for healthy lives in Europe. And, very important, we also educate and we support the transformation of education of health professionals. We do that also in citizen engagement activities, innovation programs, skill development trainings. Now, EIT Health was only launched in 2016, so we are in our third year. Just a few facts and figures. We so far have trained more than 5,000 health professionals in some of our programs and courses that we execute with our partners. Some of them have also been run here at this conference. We support startups, early incubated startups with attracting finance. We've been successful with more than 50 million euros so far. We have supported the launch and implementation and adoption of new products and services, about 42 of them across Europe, and supported more than 420 startups so far. So what's the role of hospitals then in EIT Health? So first of all, there are about 24 hospitals involved in EIT Health across our 6 co-location centers. They are mostly large organizations, including they do care, research, and also teaching. And I would say there are only a few innovation projects that do not build on the participation of a clinical partner. Now, actually, I think that it's important to know that in EIT Health, we also look at organizational and management innovation. And I think that we still have relatively few management and administrators involved in our projects from the hospital side. And taking advantage of this audience, I would encourage you to reach out and see if there's a possibility to collaborate. Why are hospitals involved? First of all, it's of course a possibility to broaden international networks. It's also an opportunity to strengthen the capacity for translational research. So from turning research into something that can actually be used by citizens and patients, and that's what we call innovation. And of course, also, there is a possibility to use some of the financial support that EIT Health can provide to catalyze and to accelerate these projects. So let me share with you some key messages on innovation in healthcare provision around hospitals. And when doing that, I also rely on some studies that have, for example, been done by Jesse Business School, one of our partners, or Accenture, as well as, of course, insights from our projects and own activities. So I think in future integrated care networks, we will see hospitals as the key providers of complex services, such as genome-based, the personalized treatments. And of course, they will also remain the providers of the related diagnostics, such as complex imaging. And we may also play a key role in chronic care management and might offer prevention services in your communities. And as we might move towards more outpatient care, hospitals may have less beds, but that does not mean that you would be connected to less patients. I think hospitals of the future may indeed be smaller, but more specialized, and that it will be orchestrating integrated care networks, provided, of course, there's the right policy framework and the right incentives also connected to payment models. So the hospitals need to be connected to deliver innovative provision models. And patients will spend less time at the hospitals. And I think at the round table of ambulatory care today, we will look into possible models for this as well. And of course, we need to improve the patient experience around hospital services and use data-driven tools that allow patient monitoring and engagement beyond the hospital borders. And of course, these need not only to be easily accessible, but they also need to be trusted. Now, additionally, we see that in the project that we support, the patients will be and want to be more involved in co-creating and co-designing these services and the modes of interaction with hospitals and their community. And that engagement may very well also center around processes and communication and the management of the care pathway, their care pathway, actually. So I think that the metaphor that Deloitte used in a recent study is quite nice, saying that the digital hospital of the future includes an air traffic light control system to continuously monitor patients and integrate data to chart the flight path of patients. Now, I think this is a notion that also might be related to the liquid hospital that we will be discussing at the Big Data Roundtable in a few minutes. Now, as a matter of fact, one of the projects that we will launch on the EIT Health platform next year is indeed called New SkyCare. And the partners amongst them, hospitals, payers, but also technology providers, will strive to demonstrate a virtual hospital in 2 European locations, the Netherlands and Sweden, with a focus on patients with cardiovascular conditions and aftercare and monitoring. And essentially, we want to build an open architecture to integrate different self-management tools and connect information to one personal record. Based on this, we can then perform more advanced data analytics and will support patient coaching and also decision-making. And as I said, we will start this in the Netherlands and in Sweden and see to expand that also to other regions in Europe. So needless to say, the development and validation of the appropriate business models is also subject to the project, but I think it's a great asset that we have indeed payers, hospitals, and technology providers involved in that very same demonstration project. So in a nutshell, SkyCare should contribute to a better data analytics for predictive modeling, that's the research perspective, but also reduce the number of in-hospital treatments and reduce the number of readmissions amongst the initially targeted patient group. And you can see the current targets of the project on this slide. And finally, the third element I would like to share with you is around new roles and professions that I think that will emerge. I think it has been discussed here at the conference as well that hospitals will need to define new roles and subsequent teaching curricula for staff in order to put innovative provision models actually in place. And we may need more disease-specific case managers, for example, who might be following up with patients every day and help them navigate the landscape of experts. We might need health coaches in hospitals who have deep insight on a patient's status. We may need more data scientists and also medical engineers. So new emerging technologies will offer support to health professionals, but also require new skills to be used effectively for the benefits of patients. Accenture released a study on artificial intelligence in healthcare, as you may know, stating that some of the biggest potential savings by 2026 will be generated through virtual nursing or robot surgery, but also things like administrative workflow assistance. And this might still sound like future music somehow, but to quote a very famous quote of Bill Gates, he said that we always overestimate the change that will occur in the next 2 years, but we underestimate the change that will occur in the next 10 years. So we should not let ourselves be lured into inaction. Now, to conclude, I tried to put a few questions for the round tables that come up now, and maybe just to inspire the commentary of the chairs of the different round tables. I'm sure that the discussions will indeed be much broader than the questions that I've put out here. So on big data, Paul, I thought that when we talk about biobanks and genome databases, health records, clinical trial records, and that they should all be much better interconnected beyond the boundaries of one individual hospital, I think a question could be, will and maybe also can hospitals actually be the driver to make this happen? On the roundtable for precise medicine for better patient outcomes, I thought that it would be a relevant question to ask how precision medicine can enable better prevention and improved care pathways, and I think especially for patients with comorbidities, of which we see more and more. And on the ambulatory medicine, I think it would be good to contemplate how administrators and hospital managers and clinicians actually need to collaborate and what incentive models need to be in place to support this change at the hospitals and how we can move that into implementation. And finally, there's also one roundtable on European innovation procurement, which I think is a very good idea. And I think here it would be very good to dig into how we can encourage a greater uptake of innovation procurement in the health sector in Europe, and how procurement can actually be an enabler and not a barrier to innovation. Now, I still have some time left. I'm faster than I thought I would be, but I will conclude here. Looking forward to the comments, and I'm looking forward to our discussions. Thank you very much for listening, and thank you.